Crisis standards of care is what we've been trying to avoid in Idaho hospitals since the beginning of the pandemic. And for weeks, we've talked about how close Idaho is getting to that point. The trigger is when a medical system is overwhelmed with people needing care and they don't have enough resources to treat everyone. So they have to decide who gets help and who doesn't. We're already hearing about some cancer patients having to hold off on treatment because of the staff and space being diverted to treat COVID patients. We've also been told with the virus continuing to spread at the rate we're now seeing, some of our hospitals are teetering and having to get creative to avoid tipping into crisis standards mode. It's a situation most often reserved for devastating weather events like hurricanes and tornadoes. Of course, crisis standards of care are not new, but they would be new to Idaho. However, Idaho medical expert and former CEO of the St. Luke's Health System, Dr. David Pate, has worked through a situation like that years ago. He tells Joe Paris that he thinks about that time a lot more these days.
In June 2001, Tropical Storm Allison dumped heavy rains on Houston, Texas, completely devastating the area. The storm moved very slowly, resulting in high floodwaters across the city.
Out our window, and we lived on a corner, and so there was the street sign that tells the names of the streets. The water was up to the street sign.
Dr. David Pate, Idaho medical expert and former CEO of St. Luke's Health System, was working at the time as chief medical officer for another healthcare system in Houston. Dr. Pate walked in the middle of the night through floodwaters to the hospital, which had been severely impacted by flooding.
I spent the next 10 days at the hospital. We had about 72 hours, if I recall. We had no power, no phones, no air conditioning in Houston in June.
Quickly, Pate and staff realized they had to transition into crisis mode. Of 3 hospitals at the medical center, 1 was completely knocked offline, 1 was only able to operate at 30% capacity, leaving Dr. Pate's hospital to take on as much as they could.
We couldn't get staff in, so we didn't have enough staff to take care of people. We didn't have the resources to take people, and so we had to tell those people at those hospitals we couldn't take their family member. And I remember the calls that I would get from doctors, from family members that were just, these family members just in tears and pleading with me because they knew the hospital where they were couldn't provide that level of care, and we couldn't take them.
As chief medical officer, Pate was entrusted with making those incredibly hard decisions on what to do with very limited space and resources to treat people in need.
The transfer requests would come through me, and I would have to make those decisions about what we were going to do with patients. It's just, it haunts me to this day. I mean, it's 19 years later, and I still think of these things. I mean, most of the time I can put it out of my mind, but starting about April this year, when we started talking about, this potential that our hospitals could get overwhelmed, I mean, it all comes back.
Pate says he believes the situation in Houston is better than what Idaho could face if healthcare systems continue down the path they're on and become overwhelmed with COVID patients. The difference between Houston in 2001 and now, Pate says there's nowhere to send patients now as neighboring states are also experiencing high volumes of patients.
It means that we have to make the choice if we do have some resources, but we have more patients that need it than others, then we have to pick which patients are going to get that.
Pate says Idaho's current path makes it hard to not think about his experience in 2001. He remembers how everyone from patients to families to healthcare workers were impacted.
It does bring back those horrible memories. And I know people died back then in Houston that, had we been operating at normal levels, wouldn't have. That pains me.
Dr. Pate says he truly believes Idaho can avoid hitting the crisis standards of care if communities start taking health guidelines seriously right now.
We could change the direction of this. It might take a couple of weeks, but that's the kind of time where we're worried about maybe we're going to be in this trouble with the hospitals. If people took those actions right now, I believe we could avoid this.
We'd like to hope we're kind of in this waiting for Godot situation where we just keep talking about the crisis standards of care, but we're lucky enough that it never really shows up.